Welcome to Conversations Live. For more than a decade, we've brought you the best in books, entertainment, celebrity interviews, and current events. When the movers and shakers of the world have something to say to you, they say it to us first. Now celebrating 17 years of broadcasting success, here's your host, Cyrus Webb.
And welcome back, everyone, to Conversations Live. I'm your host, Cyrus Webb. Glad you all could join us once again, both for our radio audience here in Mississippi at WYAD 94.1 FM and WYADonline.com. We're glad that you all could be with us. Also, just joining us through our friends at iHeartRadio and Amazon Music Podcast. We're glad you all could be with us as well. Well, this is part of our For-Your Health segment, and this is a really important thing for our audience, especially as you guys are getting back out, making sure that you're checking in with your doctors, getting those checkups, and having the conversations, of course, with your doctors that are so important. A lot of us are seeing, of course, the importance of not only being able to treat different diseases, but also the importance of knowing ahead of time what we might be impacted by and how to be able to best get the best treatment for that. One of the things that may not come on your radar is a rare type of lung cancer called MPM. There are some new treatment options to be able to consider, also dealing with the latest technology as well. Here to tell us about it, we're excited to welcome Dr. Niraj Mehta to our program. He's going to let us know some of the information about the technology and treatment, who it might be right for, and where you all can get some more information. Dr. Mehta, thank you so much for the time. Really appreciate it.
Seriously, it's a privilege and honor to be here with you.
Well, Dr. Mehta, we have been definitely encouraging our audience now that things are open back up to make sure that they are, of course, making their doctor's appointments, being able to stay consistent with those. Of course, we all know the importance of finding out about things early, and MPM is something that I'm just now learning about this year. What exactly is MPM, Dr. Mehta, and how prevalent is it when it comes to lung cancer among Americans?
Right. So MPM is called malignant pleural mesothelioma, and it's a rare type of lung cancer. And we're talking about 2,500 people in the United States diagnosed every year with MPM. So where does this come from, right? So MPM actually comes from the lining of the lungs themselves rather than the actual lung cells. So it's from the protective linings of the major organs in the area around the stomach and the chest. And MPM is closely associated with past exposure to asbestos, which is prevalent in certain types of jobs. And so about 90% of all mesothelioma cases are due to asbestos exposure.
Well, that is something to know. And I think, too, for our audience out there, that's something for them to be able to keep in mind, too, when they're thinking about things they need to be having as far as conversations with their doctors. Now, I mentioned that you're going to talk to us about some of the treatments. What are some of the latest FDA-approved treatments, Dr. Mehta, available to treat MPM?
Right. So for over 15 years, there were no new treatments approved for patients with MPM. So at the time, the treatment options included surgery, radiation, chemotherapy, immunotherapy, and now what we call Optune Lua together with chemotherapy, which begs the question, what is Optune Lua? And Optune Lua is a small, light, wearable device that is used with chemotherapy to treat unresectable, locally advanced, or metastatic MPM. So Optune Lua actually produces electric fields. They're called tumor-treating fields. In and of themselves, the tumor-treating fields disrupt cancer cell division, potentially causing these cancerous cells to die. In addition to chemotherapy, where it actually demonstrated an overall survival of 18.2 months, which is impressive.
Dr. Mehta, I know that's going to be good news for our audience. And so I guess an obvious question would be then, if one of our audience members or one of their loved ones or friends have been diagnosed with MPM, what should they do, and what should they know when it comes to the treatment option that may be available for them?
Absolutely. So in summary, it's all about empowerment. So finding out that you or a loved one has an illness, let alone something like MPM, can be overwhelming. All of a sudden, you're facing unfamiliar challenges. You're dealing with an existential crisis. There's a lot of mental health issues involved. You're making important treatment decisions. And so learning about your options can be a good place to start. Also, obviously, talking to your doctor about what treatment options will be available for your loved one. But viewers and anyone who wants to learn more about MPM can go to learnaboutmeso.com. And again, that's just one word, learnaboutmeso.com, so we can get a background on mesothelioma. And so when it comes to treatment, that the patient or even the viewer can feel empowered about their understanding and really understanding, what are the options and how we can learn a bit more. And obviously, you can go to the Optune Lua website and kind of see how these electrical fields actually look like in practice, or how patients can actually use them and incorporate them into their daily routine.
Really good information. We're going to make sure that we link both of those sites up for our audience. Again, everyone, Dr. Niraj Mehta has been our guest, sharing with us some great information about not only NPM, but also new treatment options as well, where you guys can get more information. Dr. Mehta, really appreciate you stopping by the program today.
Thank you so much for your questions and for educating your audience. It's awesome.
The pleasure's definitely all mine. I couldn't do it without you. And we thank your audience for tuning in to another great segment of Conversations Live, part of our For Your Health edition. Hopefully you'll be able to find something you can be able to share with your loved ones and your friends as well to be able to help them in their own health journey. Until next time, I'm your host, Cyrus Webb, saying as always, enjoy your day, enjoy your life, enjoy your world. Thank you all for choosing Conversations Live. Now let's go make today amazing. Take care.